give me great pleasure, I will introduce Professor Farida Fortune and Professor Mohamed Hassan. They both here, yes. They are the two moderators and the rapporteur for the next session. I think both of them, I don't know where to start, but Professor Farida has been tremendously supportive of everything we have been doing for many years. And like you said, Professor Dua earlier, the beauty of what we are doing here, we have a mix of backgrounds and experience. For example, now we have Professor Farida. She's a professor of medicine with oral health, and we have Professor Mohamed Hassan. He is a reader in chemical engineering, and they're going to be the speaker. They're going to talk about different prospects and from the 3 different cases from Qatar and I think from the UK, and we have another speaker from Libya. So I think she has a wealth of experience, Farida. She's a global mind, really. I mean, this is the best thing to describe her. She has a tremendous experience worldwide. She used to be the dean of the School of Dentistry, Institute of Dentistry at Queen Mary University. Dr. Mohamed Hassan is a reader at Southampton. He got a brilliant experience, a good track record on chemical engineering. He also himself worked in the Middle East before, I think in Egypt and in Kuwait. I think he had the experience in the Middle East as well. So I'm going to hand over to both of you, Professor Farida. I think you are, I already made you, or we made you already a co-host, so, and you are unmuted. And Mohammed also, we made you co-host and you are unmuted.
All right, I do now. Thank you very much for asking me, Dr. Adam. You know, this is amazing. And the drive throughout COVID has really been new in various aspects of how COVID is affecting our lives. This has been hugely transforming, in some ways good, in other ways not so good, but we all are having to totally rethink our lives and what we do. So this next session is higher education leadership and future strategies. And I'm really, really pleased with the speakers that we have, because they've come from a really diverse background, and I think will add to trying to address some of the issues. We are going to have to teach differently, lead differently, and actually start looking at the skills that we need. So I work in London in higher education, and we have students from more than 200 countries coming. I also work quite a lot in Africa, and I can see the huge differences in, if we're going to move to a digital age and a technological age, actually we've got to put a lot of resource, and the UN has to put a lot of resource into the developing countries, much more than now. But it's not only the teaching. You can't teach, as Professor Babaka was saying, when there's no power. And it's not only in Sudan, the whole of Africa has power outages day in and day out. And how do you deliver Western style learning? How do you lead Western style learning? It's obviously not appropriate. So I'm looking forward to our speakers. Dr. Hend Al Muftah, who's from Qatar, so comes with a different perspective, has huge lessons to teach us. Dr. Mohamed Masaud, who's the director of in Libya. I've had quite a few PhD students from Libya. Now, I can say that up until when they came, the education was excellent, because my best students have been my Libyan students, without a doubt. So how are you going to lead and change your strategies, Dr. Masaud, going forward? And then I'm really, really pleased again to have Dr. Andy Beckingham, because he comes with a public health perspective at leadership level. And the other thing that's a problem everywhere, although we're talking about inequalities of health and in race in the UK, this actually is all over the world. And so I think there are going to be huge lessons for all of us. And then I have a fantastic rapporteur who is going to sum up on everyone's talk. So hopefully we're on time today. So we'll start with our first talk, Dr. Hend Al Muftah. Thank you so much.
Thank you so much, and thanks, Wiz, for welcoming me and for the introduction, and also for giving me such opportunity to be part of this very interesting debate. I would like to talk about higher education leadership in Qatar, and I will not be able to talk about it as a kind of leadership theories or even as crisis management or even the sustainable development goals that have been covered in the first session. But more specifically, I would like to talk about it as a kind of case study that can be presented from Qatar and how the leadership in this case, which I'm talking about Doha Institute for Graduate Studies, how did they respond to this crisis, trying to do, and actually I would say struggle to do their best in a way to keep and maintain the quality education and learning process, which I'm sure it's been spread over all the world. And needless to say, that this is an excellent opportunity to share different experiences and piece of knowledge where we can benefit from each other in a way to move forward our higher education. Now, to start with, unfortunately, overnight, we just find ourselves, as educational leaders in the universities, we find ourselves, the leadership hierarchy has been flattened in a way that has never ever been before, that we have never witnessed before. But anyhow, there's a sound, I can hear there's a sound. But anyhow, I've been, talking about myself, I've been working in education, higher education institutions, specifically leadership positions since 20 years ago. So my experience in the education sector taught me that an excellent and effective leadership is the one who had learned how to continuously learn and who is able to lead change together. That's why, to me, when talking about leadership and how the leadership in any higher education university is being responding to a crisis as the COVID-19 pandemic, I would definitely be able to promote the model of leadership. It's not a role or responsibility or a task, individual. Rather, it's a group process and shared responsibility. So that's why I wouldn't like to talk too much about leadership definitions and literature. It can be easily found.
Professor Hend, I think you can share your screen if you want.
Just to make it very brief and short, when we are talking about leadership in university, we are not talking about an admin piece of work or a one-person show that can have and manage all the financial and admin and academic responsibilities and roles. Rather, we are not talking about a group of people who are managing or monitoring the whole process. We are talking about mobilizing. We are talking about mobilization. We are talking about ownership of the whole people, including faculties, students, parents, society at all. We are talking about changing and how can we part of such changing. And more significantly within this, we are talking about adapting and how we can keep moving and changing our styles, our methodologies, our approaches, strategies, and so on, to the extent that we would be able to continue our learning process. Just to start with, Doha Institute is a postgraduate studies institution that was established in 2015, and it's mainly focused on social sciences. It offers plus 18 master programs, and it's going to start its PhD this coming semester. It has more than 1,000 graduates, currently more than 450 students, international from different nationalities. And it has more than 50 faculties and 100 staff. Now, when the COVID-19 pandemic, came as a crisis, it really affected most of the universities all over the world. And most of the universities find themselves not only in the front of the lockdown and the social distances, but they find on themselves that emerges and the urgent of finding not a quick response, but more quality response in order to maintain the quality education and not to affect the learning process itself. So the main challenge to us specifically in Doha Institute is to find creative solutions. I'm not talking about, of course, IT, but more specifically the academic and admin solutions to maintain the learning process and the quality education, taking into account that we have a kind of social sciences and we have more than 50 nationalities around the world. And taking into account that many students, they went back to their home and they couldn't come back again due to the restrictions in the traveling and so on. So it started by the 9th of March, where the government of Qatar announced or took a decision that all universities and the schools should be closed. And at the same day, or the second actually days, DI took an immediate and urgent decision by creating and establishing a crisis management steering committee, which one of the agenda or priorities is to find an IT solution how to go ahead within this decision and the closure and so on. Now, being a part, of course, in this committee, it wasn't an easy task for us because, like we were running and, breathing in everywhere and every different aspect of the academic learning process. But by the end, I'm talking about a week later, since we started our continuously meeting for day and night during the first week, we started establishing a communication and cooperation mechanism and how to interact with the students, faculties, and all the members of the society and the university and what's going on and how are we going to deal with the expected challenges and so on. We start, of course, by identifying means of education delivery by adapting a new online learning software, educational resources, the library, the virtual labs, and so on. We start also specifically with some subjects, with some programs to prioritize the curriculum goals, including the assessment mechanism. Like, for example, we cancel the field trips, we cancel, a kind of a group seminars and so on, and we replace it with something else. More specifically, also recently, we started rethinking the design of the e-learning itself, a process and teacher training in order to move away from the emergency remote teaching towards more proper future sustainable online learning. And that's why we came back to the hybrid learning and we start using recorded video classes and so on. However, the most challenge we still, or the action we are still taking is the continuous discussion and training in order to have more continuous learning. But the picture actually wasn't rosy and the experience itself wasn't very, very nice as expected. We did actually face a lot of changes, a lot of challenges. One of the main and most significant change is the academic integrity, where we had witnessed by the reports of the faculty and the different behaviors and the practices among the students is that cheating is not only in the assignment and the research, but also in the exams itself. And we find a new phenomena, where some students were used to go to the outsources or paid researchers in order for them to make their dissertation, and this was the disaster. We found because because Doha Institute offers a lot of scholarship to international students coming from different parts from the world, but mainly we have a lot of students who are living in refugees camps in Jordan and Palestine and Yemen and Syria. We are having a lot of students from Sudan and Yemen and other countries. So we find that some students find it very difficult for them to access the technology itself, the virtual learning, the educational resources, library, the online. So we have to think about other alternatives and how we can help those students. We find also that many students, majority 90% from students and faculty, they start complaining from the extra load and extra efforts they have to put in the classroom and even in the after classroom where they have to continue, checking their emails, correcting their assignments and so on. One of the major issues was the mental health also, specifically among the students. Now for female students, and because of the closure and lockdown of the most part of the world, females find themselves in a very difficult situation because they have to, to struggle with their own children who were actually, they have their online resources. Now, the conclusion when it comes to leadership, at Doha Institute, we took the approach of the adaptive leadership approach, where it really helped us in accelerating and the response of the pandemic. How did we react to it? In a way that it was more flexible in facing the challenge. So if this tool didn't work, we have to move immediately to the second tool. If this approach didn't work, we have to change it right now, and so on. So we were so adaptive in how did we take the different decisions and reacting to any challenge. In addition, actually, there was one other advantage within our adaptive leadership is that DI was so proactive in diverting their strategies and approaches and responding to the specifically, I'm talking about the logistics and academic challenges. Like, for example, when some students didn't have an access, any student in Sudan or Yemen or somewhere else didn't have an access to the Wi-Fi or electricity, we used to, to contact our embassy and ask them to facilitate like a kind of university place or an office or something like this where they can have a direct access. Now, moving our leadership within this crisis. I believe strongly that change is a must in any higher education institution. Thus, it should be very planned at the very earlier strategies. And having said that, this will lead me to say also, like we used to have a lot of projects, including the IT learning, the e-learning resources, that used to be very difficult to achieve for some, IT or financial reason. However, it was so possible and so easy to handle and implement just in a few weeks after the pandemic. Learner, HE or higher educational institution is very important nowadays. Continuously changing is an important to survive and thrive in any higher educational sector. Of course, we need technology, but technology is being shifted from being an enabler to as a catalyst for change. And then when I say catalyst, we really mean a lot of how it will help us in changing the e-learning process. In addition, we have noticed something that we need an effective and a quick, adaptive leadership in how to deal with changing demographic change, structures, demands, circumstances, specifically when it comes to higher education that are really have a lot of international students, has time framing, unable to access Wi-Fi or internet connection or e-resources, specifically if you have international students who are coming from poor areas or conflict areas or even refugee camps and so on. And more significantly, as a leadership and how to deal within this crisis, we find that changing admin, structural, cultural, and even pedagogical mechanism is in managing sustainable and innovative higher education institutions is really becoming more important nowadays. I think I'm done in 10 minutes, hopefully. Thank you very much.
Thank you. That was excellent.
Thank you very much, Dr. Muftah. It's been very enlightening to look at academia from a leadership point of view, because for the last year, I've been engaged in the teaching and research elements, but I've looked at it from an operational point of view as an academic who delivers the material. So to look at it from the strategic point of view, look at it from the leadership, as you said, it is key to engage with all actors in the process. It's not a process of control for the vice chancellors or the deans. It's all actors, from the students who have to deal with different elements of life to the faculty who have to deliver to the admin staff. So it's a group effort, and I'm glad you've highlighted this point here. And it's looking at the Doha Institute, it's quite fascinating to see how the crisis crept on all of us and how you dealt with it in a very good manner. Initially, all of us dealt with it in a reactive manner, where we speeded up towards applying intellectual solutions and trying to go through Zoom meetings and other things like that. But as we started developing these IT solutions, it became apparent that there is a list of issues that we have to maneuver around. One of them is the curriculum learning outcomes that have to be addressed. In your point of view, you had to cancel some field trips, cancel some of the seminars or case studies or engagement. In our cases, or I'm sure in Dr. Farida's case, we had to cancel some clinical engagements or some lab sessions and practical elements, which impacts on the delivery and the quality of the certificate that we're trying to issue. So it became more apparent that leadership has to engage with the process. And beyond this, you also highlighted that the academic integrity has been brought to questioning under this iSolution virtual control lab that we live in at the moment here. And with that led to other issues such as the accessibility of the internet. And I think in our previous sessions, Dr. Ali from Al Jazeera University highlighted this, where internet is not available for his students in Sudan. And if it's available, it's too expensive. And that's one of the biggest elements. So it was good to see how the leadership of the Qatar Institute has maneuvered this by engaging with the embassies in host countries to facilitate the international students' learning by providing some of the internet for them. So in your case, you did not actually just list the problems, but you actually gave the solutions and how we overcome it. And I think one of the biggest elements that you've alluded to is the fact that not only women, but all people locked down in COVID situations are experiencing the family work syndrome, if you want to call it that. In my case, my wife is a key worker who works on a daily basis. I'm stuck at home with 3 children. One of them is a 10-month-old baby. And beyond that, I have to deliver a full-time job, academically teach to my students, meet my PhD students, deliver my research, engage with the wider community here. And it has been a challenging experience. And the fact that you sponsor some of the refugees in Jordan, in Syria, in Palestine, they have even a higher affinity and higher issues to deal with in terms of the communication, in terms of dealing with the general environment, the health and safety aspects, the mental issues. And I'm glad to see that there is a proactive leadership within the Qatar Institute that define the problems, address the problems, and try and think of innovative solutions of how to address it. So it's very enlightening to look at leadership from a different point of view, and thank you very much for that.
Okay, thank you. So we're going to move on to Dr. Mohamed Masaud. Thank you so much for talking. And we again look for how Libya has not only had, hello, can you hear me? Yeah, how Libya is not
yes, I can.
Yeah. How
Can
you
you
have
hear me?
not, yes, I can. So we look forward to hearing from you, not only how Libya has had a crisis with COVID, but also been having other problems as well. And from having, I know, absolutely excellent outputs from your schools going into university, how are you managing to maintain at a leadership level that quality? Thank you very much for your talk, sir.
Thank you very much indeed. First of all, I'd like to thank Professor Allam Al-Noor, and also I'd like to thank my colleague, Dr. Mohamed Masaud, or Mohamed Masaud. They invited me to speak to you. That's number one. Number two, I'm so happy that I'm in contact with the World Association for Sustainable Development. And I'd like to clarify that what I'm going to talk about today is not a scientific article. It's not something which is based on research, but it's based on the observation, talking to people, and also I'm a radio broadcaster. I listen to people, especially educational programs and talk show. First of all, Libya, the title actually which I chose is Higher Education in Libya, the Lessons Learned After the Corona Pandemic. As you know, that as a result of...
So, Mabruk, do you want to share, or shall I share for you? Do you want to share your screen?
No, it's okay. You can do it, so you make life easier for me.
Okay, no problem. Okay, go ahead, carry on.
Thank you very much, Dr. Allam. Thank you very much. The spread of coronavirus throughout the world, many universities and schools closed their doors. Libya is not different, but I looked at the UNESCO website and they said that 90% of students are out of schools. In other words, that's what they said by March the 31st to 2020, schools and universities were closed in 188 countries. Libya is not different, but there's something which surprised me. So there was a letter from the Minister of Education. He sent it to the Minister of Health. That's dated on the 27th of Feb 2020. and he's telling him under the title urgent and confidential, and he's telling him that if there are any measures to be taken, if we can start a campaign to raise the awareness of people of the dangerous virus, corona. But on the 13th, the minister issued a decision, and that decision was straightforward, that schools and universities should be closed. So this is our first experience with coronavirus. So closing the schools, that means that there will be a price to be paid, because we have teachers, head teachers, mentors, people who work in the Ministry of Education will stay at home, and they will keep on receiving their salary. So this is, in my opinion, this is a loss of the spending. But also we have many young people, I think primary education and secondary education, it's up to 1,600,000 students. They're going to stay at home. Some of them will be in the streets. Unfortunately, after the unrest in Libya, we have, I don't know how to say this, but the drug dealers and the bad, if you like, the bad people, they started their work. So that's why I said they will be exploited by drug dealers, especially in the last 10 years, I mean, after the unrest. So I made this clear even to parents when we were trying to convince people and to convince the head teachers and teachers and those who are in charge of education, that keeping the students from the street will be a benefit. Anyway, at that time, we felt that there are certain changes, because our system is based on the traditional way of teaching and learning, maybe lecturing. It's the didactic teaching, as people say. Some people describe it as a jug and mug process. So we thought about the online and distance learning, but there are challenges. We thought about it. That's the first thing which came into our mind, and the first challenge, actually, we call it the digital gap. In other words, we don't have the infrastructure for the internet or e-learning or even distance learning. Also, our members of staff are not really trained to use the internet in teaching and learning. So this is another problem, another challenge. So we need to, how can we teach, or let's say train our members of staff in the university to use the internet, to use we call it cooperative methods of teaching and learning. But also students themselves, they don't have, many students, they don't have, neither in the university nor in their homes or houses, they don't have the internet. So that's another challenge if we want to think about using the e-learning or the distance learning. But also we have a problem that teachers are not really trained. They cannot supervise the teaching learning process. They cannot evaluate it. That's going, especially if we adopt the online learning. The other thing, which is, I think you are aware of that, the power cuts continuously for very long hours. We have a problem. It's like, Libya is a very rich country, by the way, and they can provide themselves with the electricity, because we have the gas, we have the oil, we have everything. But unfortunately, now it's winter in Libya and it's freezing, and we still suffer from the power cuts, which continued all over the last 10 years, if you like. We have what we call recommendations for finding solutions for distance learning. By the way, we had a very, let's say, humble attempt, especially in Benghazi, to start what we call it the distance learning. But unfortunately, it's the same old story. We have inspectors or teachers who will teach lessons and then send them, or maybe via the in CDs, or maybe they can upload them on the YouTube, but it's still the old story, which is didactic teaching. There's nothing interesting, and because of the power supply, so students could not get access even to the televisions. So these recommendations is addressing the digital gap, which is that's, I know, especially because of the unrest in Libya, the only thing that they do actually is supply or give us our salary. The third, we call it the third part, which is responsible for development or building buildings or providing the services like the internet. They don't have money for this, but we still say internet should be provided and be used in higher education institutions. We have to train the members of the staff so they can use the internet effectively. They can upload their lessons. They can design their lessons to be attractive to students. But also using tools, media available. You know, the online learning, sometimes it's synchronous, sometimes asynchronous learning. And you are aware of that, I think. So these are the recommendations that we put forward to universities, but also establishing the rules for students, because when students go online, there are certain rules. We encourage them to use what we call the formative assessment. Unfortunately, our staff are not really trained to use formative assessment. Most of the exams or the tests are to test their knowledge or their memory. How can they memorize the information? But using the online learning means that students will get involved in learning, but also the way to assess them, you know, it should be different. That we should encourage we should train the teachers so they can use very effective and also modern ways of testing their students. But also establishing this is a very interesting attempt by the Ministry of Education, and we did this. So still in the beginning, we've established the General Center for E-Learning Technology. And their main, if you like, task is to expand the e-learning and produce interactive educational material. It's still in the beginning, but we have a very interesting people who are ready to start and the trained members of staff, university teachers, but also teachers in primary school and secondary school education. We had what we call it the regulation for the e-learning, because you know, in Libya it's not like the rest of the world. You know, if you are using something in education, people, they will go to the court and say this type of education, which I mean the e-learning, is not if you like prepared or designed or controlled by the we call it the regulations. So people can accept the e-learning. The universities will accept the e-learning as well. It's going to be something legal, and then we can use it to train or to educate our students. So we needed the regulations, and we did that as well. The most important thing to us, or to me, because I spoke to the minister, by the way, this memorandum of memoirs, sometimes I send it to the what we call it the National Planning Council, but also I send it to the Ministry of Education. Corona pandemic, we thought it's going to be an alarm to wake up. So it's like to wake us in Libya, to wake the higher education sector in Libya. In the past, our learning methods, our members of staff, lack of resources, we don't have the e-learning. So this is a warning to us. You know, guys, wake up. You need to train. You need to use the e-learning. This is can be an alternative, or it can be used to support the classical, or let's say traditional teaching and learning in the universities. So we need what we call flexible approaches, which in fact, what we mean by flexible approaches actually is the e-learning or the distance learning, especially in times where we have a lot of crises, a lot of risks. Institutions can swap from the traditional teaching learning to the e-learning. But also we need to activate, the role of offices. We have offices like we call it social services, or the psychological, if you like, guidance offices. We need this. It's like a must, because unfortunately, many students in the universities, maybe in schools, they become victims of the drug dealers. There are certain cases which is like, in my opinion, it's like a spread of using the drugs in the universities. Young people who have nothing to do, they receive money from the government, but also, no activities, no learning, no studying, so they will be a victim for those people. But also in schools and also in universities, we have phenomena which is called bullying, and people attacking each other. I don't know, maybe because of the social problems, maybe economical problems. That's why we need to activate the role of these offices like the social services in all the faculties and all the universities. But also because of the pandemic, showed us that we are falling behind in terms of the health services. In the past, in the 70s or 60s, people used to tell us, those people who study in schools and universities, they used to provide the medical examinations, for the students, check up teeth, general health and everything. So we need to activate these offices in the universities as well as in schools. But also we need to pay attention to, public health sector, public health in the university. This is specialization. We need to direct students to study in these departments or sections in the faculty of medicine. But also you will be surprised when I talked about we need to pay attention to health and higher education, and also provide the toilets for both sexes, toilets for women, toilets for men, toilets for disabled people. We don't have these facilities in the universities. So we need them now, but also we need to provide some universities, some faculty don't have even the basic things like the water, like the soap, like, cleaning materials. So we need to provide that. But also we need to pay attention to community health specializations, encourage postgraduate students to study viruses. I know Libya is a third world country, but at least we need to start. We cannot just rely on vaccination or people from outside the country to tell us what to do. We need those people who are specialized in research, studying viruses. Maybe in their laboratories, they can think about study these viruses and tell us about what to do and if they can prepare or vaccination or whatever. I know this is something, it's a hope, but we still have a lot of people who are very educated and they can provide us with sometimes we need the information, the protocols, how can we fight this coronavirus. And also we have generous suggestions for the universities, and we need to encourage the universities to take part in the society, serving the society. So establishing medium technical, unfortunately, establishing medium technical vocational education institutes which they students who get they join the university because this is the only alternative to them. They don't have any other alternative but to go to the universities. So and this is the suggestion that we put forward to the Ministry of Education. You know, the medium technical and vocational education institution, it's after the preparatory school. So they can go to work, they can go to these institutions, so they get the profession, and in the future, they will be trained to do the physical work, vocational and technical. That will reduce the number of students, because we have large number of students who go to the university because they have no other alternative. University leadership, unfortunately, when we visited, I visited with a team. Dr. Fatima is the deputy minister. We visited about 13 universities in the eastern part of Libya. And we discovered that the leaders are not up to the level. So we thought about, when we talk about governance, when we thought about, you know, you have a council and you need to consult your council, your decision should be based on data and information given to you by research, by the leaders in the we call it the university administrations. Those people are not to the level. So we thought about changing the university leadership. And also we opened the door to the new candidates. And those people should be honest, and those people should be capable of managing the university. And those people who would activate the role of administrative and financial departments. We need, it's like, you know, the main principle to lead, and you lead with, you know, the other members of staff. Your decision should be based, as I said, on information and data given to you. Activate the role of the legal department. It's very important. Finally, develop interest services to ensure, internet service, e-learning, to ensure that the quality of communication between the Ministry of Education and the universities. Sometimes we need statistics from any universities, and they said, oh, we can't give you that now because of, you know, we don't have any internet service that we can use to receive information from the universities. But also we need commitment to transparency. We need to fight corruption. We need to convince the universities, and also the president, we call it the president, the head of the university, that they should be honest, they should be transparent. Any decision should be taken by the council, which is the university council. So I thought that these are the lessons that we learned from the coronavirus. So I think I would like to say thank you for listening to me. But if you have any questions, please ask me and be my guest. Thank you very much.
Thank you very much, Professor Mabrouk. That was a very interesting presentation. All of us are experiencing the difficulties of leading an educational system during the COVID, but to look at it from different perspectives is very fascinating. And the fact that you went into lockdowns throughout the academic systems on the 3rd in March 2020, and that, in your point of view, was a loss of income in terms of expenditure, but it's also in terms of engagement with education, which led during the unrest to social disorder within the students engaging in other activities than academic activities. And this is a very crucial point that not a lot of people have alluded to, is when people have time, they are idle, they have nothing to do, that's when social disorder does manifest itself and materializes itself. So that is a very interesting point that you've alluded to right from the onset. And with that, you started highlighting some of the issues about the online and distance learning issues in terms of faculties themselves are not equipped for for delivering online, and a capacity development program should be established on teaching the teacher how to deliver online. We're all used to the classroom engagement, feeding of our students, engaging with our students in a visual manner where we can feed from their energies, but to talk to a blank screen where you don't know how people are behaving, how they're engaging with the learning is a big issue. So that was the first point that you alluded to. Second issues is the availability of the internet and availability of equipment in-house. That's a big problem, not just at the student level, but at the teacher level. That's always been a big problem in terms of the engagement, which adds to the complexity of, if the resource is not there, how am I supposed to deliver the element? And you've added the extra dimension, which other speakers have alluded to in Sudan and Libya and other places, where the power cuts, despite the wealth of availability of resources, the infrastructure is not equipped to deliver the basic needs in terms of energy, never mind internet and communication and higher learning abilities. So you've highlighted a very great element for us, and you actually propose some solutions. I mean, some of the solutions you proposed is synchronous and asynchronous teaching, where some of the lessons are recorded and then uploaded to YouTube. But the problem of infrastructure and the problem of education on how to do things online and the power cuts prohibited you from implementing this. Yeah. I know other speakers in past conferences and in this conference in Sudan have alluded to radio delivery, because it was an easier method of engaging with the learning. And with that, brought in different elements in terms of the quality of teaching. The way we assess the students was a big element. I mean, we're all used to the summative element. Here's a coursework, you give it back to me. Here's an exam question, you answer it under control conditions. But nowadays, we have to engage with learning from an analytical point of view. The formative feedback is very important, and the student to reflect on the experience and synthesize the knowledge became very apparent for us to engage in. So that's another good point that you've alluded to that we need to actually come up with, is how do we inform the students formatively of their performances, and how do we encourage the students to perform as a reflective auditor of learning rather than a regurgitator of information that just spews it out, excuse the expression, on an exam paper. So we want to develop well-learned thinkers rather than just people who can memorize things. And this is one of the greatest elements that we're developing from the COVID era at the moment, is we're learning new methods of delivery and assessment that will help create a better generation who can synthesize and analyze and engage with the learning at a different level than, as you said, the memorization elements here. And you're engaging with the ministry and through your activities with schools and other people to develop new regulation. And this is very good, because COVID, as you stated too, has been a wake-up call, not just for the academic education in Libya, but globally. We need to enhance the performance of academia. And one of the things that you've alluded to, which I think globally we failed to address, or we ignored, is we started commercializing education. We started using education as a go-to from high school. And we ignored the vocational element. And vocational element is very important throughout the globe, in the fact that we need to distribute the operators from the thinkers, from the academic engagers. So that's a very good point that you've alluded to, that this has been a wake-up call to enhance education systems throughout the system, throughout all walks, from schools to high schools to universities to higher educations. Throughout that, we need to do it. We need to have a new flexible approach to learning. The old methodologies in terms of deliveries, in terms of curriculum design, in terms of teaching and assessment have to be adapted and have to be improved to cater for the new norm that we live in here. And social impacts have to be addressed. And I'm very interested in the fact that you've alluded to social impact and health, public health, at all levels of education. This is very important, because it's not just at the junior levels that government should be engaged. It should be engaged throughout the learning experience that we have to do here. And the fact that we in Libya, you want to establish postgraduates who engage with the Libyan systems. You want to generate academics who are thinkers, who are implementers, who are innovators for the Libyan market, rather than attracting the internationals to come in at the high cost while your public sector is lacking behind. You actually want to develop your own in-house experiences. And I think all the policies that you've alluded to and the directions that you've done, although they were unique to your experiences in Libya, they are global and they crossed all over the MENA region here. And towards the end of it, your social reforms in terms of establishing good governance, in terms of finding the good financing for building the IT infrastructure and the e-learning infrastructure, addressing leadership at all levels, not just at the ministry level and at the higher levels, but doing what Dr. Hanadi was referring to, is leadership is a process of engagement. All actors within the system should engage with this here. And the last point, and the most important point you've alluded to, in my opinion, and I've said this in all academic forums in the past, and I keep saying in the future, is we need to rethink of higher education, not just the academic skills, but the vocational skills. We need to build in that vocational layer between high schools and higher academia to distinguish the operators from the strategic developers. Thank you very much. And it's been very enlightening to listen to you.
Thank you. Thank you, Dr. Mohammed. Thank you.
Yes, that I can reiterate. That was very good. And it's very interesting because when you don't have anything, you then think the most innovatively. And I think the whole of Africa is going to be much more innovative, because really putting in a digital infrastructure with the whole of Africa having power cuts, and I don't see it being changed anytime soon. We need some other solutions, but that was fantastic. So again, like Dr. Muftah, excellent speaking. I now move on to Dr. Andy Beckingham. And again, I think this group is quite interesting because it's coming from different perspectives. So he's worked in both in education, in public health, and actually also at a higher level in the NHS, dealing with this problem of equality. And it might be race equality in some places, in other places it would be about religion, of age, of sex. And I think all of us have to say that everyone has an equal role to play. So I would, without stopping now, get Dr. Andy Beckingham and invite him to present his session, please.
Thank you. Can I check that you can hear me?
Yes, I can. And we can see you very well. Thank you very much.
That's not an advantage. I'm going to put my screen up shortly. I am an independent national health strategist. None of what I have to say reflects on any person who may employ me. It doesn't reflect on the UK's Faculty of Public Health, for whom I'm an advisor. What I'm going to propose is the need for radical change in higher education and in health. And so I'm going to say that COVID-19 adds to the challenges of higher education. Higher education's role.
Can you share your slide? We give you co-host.
Yes, I am trying to find them. Could you do that? Could you do that for me?
Yes, I can do that for you. No problem.
Please do.
Yeah. No
so if you could put the first slide up. Is that working?
Yeah, I am just getting that for you.
Okay, so COVID-19 adds to the challenges of higher education's role. I'm going to refer specifically to Sudan and Sudan's SDG health attainments and health needs. Existing higher education policy for Sudan was not going to fully address Sudan's health needs. And now the damage which has been done Oh, stop. Can we go back to we need to go back to, yes, that's it. So, yes, stop, please. So, the damage done by COVID-19 has impaired not just Sudan's higher education as it stands, but it's impaired the need for multi-agency and national health sector capacity even more. And to address this, I absolutely believe that a much more radical revision of national health strategy in Sudan and the higher education strategy in Sudan is necessary in order to achieve Sudan's SDG health goals. They cannot be provided for by existing higher education policy for medical and health professions. And just to give you an example of that, if I say that this is all without criticism, I am merely saying what I've observed and what I suggest, is that, for example, Sudan will face a massive increase in cardiovascular disease, diabetes, and other problems with changes in lifestyle. These develop in the earliest decades of life. They are already present when people are in their 20s. But from my outside view, Sudan's higher education policy for medical and health professions has been focused on treating it when people are in their 60s, when their disease has already progressed to a stage at which prevention is not possible and at which treatment is possible. And that's when people have to take long journeys from out of state and into Khartoum, to Emergency Street, and to go and see doctors in hospitals. It is not preventively oriented. So what I am proposing is a national preventive health strategy instead. More radical than that, I am suggesting you turn your communities, your community leaders, please stop, don't advance the slides. You need to turn your young people not as consumers of higher education, but into health and education leaders for your country. Now, this is ambitious, but if you don't do it, Sudan will fall behind because there are so many challenges and so many health needs. You will also become prey to the predators from outside, the large countries who will want to sell you increasingly lifestyles and products that damage health, bad food, armaments instead of healthcare, bad habits, computer games to divert your young people away from education and into leisure. So what I'm going to propose is that doing the same old thing nationally in terms of higher education will result in the same old health, the same divisions. You are now in a unique position in Sudan in that you've had a revolution. So how easy it is for a foreigner to come along and recommend changes, especially in difficult times. Let me make it clear, I'm not criticizing your higher education. It has produced doctors who I know personally, many, who are internationally known as excellent doctors, and my country steals them. The welcome that I received in Sudan has given me an enduring love for Sudan, and I want to see your health needs met and its inequalities narrowed. And that's the only reason I'm saying this. What I'm saying is that excellent universal education needs to be supported now in Sudan by national policy that prioritizes education and health. You face huge barriers, I know, such as the internet, lack of electricity, and all the pandemic restrictions. But in a crisis, Sudan is now in the post-revolution phase, and you have an incredible opportunity to make national changes precisely because the world has changed, and you need to rebuild and refocus higher education to do completely different things for health. I say. I'm simply suggesting an alternative strategy. This is easy for me. I'm not there. I don't have to do it. I'm saying this is what I've seen. Education is the biggest influence any countries have on health and inequalities. Healthcare, far behind. Education is the thing. And I recommend investing on a major scale in order to improve Sudan's health. Make it sustainable by putting higher education into the hands of communities, not keeping it as something that a few people decide. Hand higher education and education for everybody over to community leaders, faith leaders, instead of a small number of people, and invite your citizens to engage in not just getting higher education, but in contributing and leading it. So what we know is from many countries is that having a few health professionals, no matter how fantastic they are, does not meet your health needs. Certainly it provides fantastic treatment for people, but that's not preventive. People are still going to get sick in the first place, and health professionals aren't going to stop them if they are focused on treatment. So what you need is a massive cadre in Sudan of new health leaders, health advocates, and health activists. I can't tell you how to do it. I'm an outsider. There's so much I do not know about Sudan. But my suggestions arise from my experience of working in Khartoum in 2015, 2018, and my strong interest in Sudan's health needs. So Sudan's emerging into a phase in which you've got huge opportunities, in which if you are bold, you will seize those opportunities, and you won't just say, oh, how can we do a bit more with fewer resources? That's 1970s US management speak. It's nonsense. It doesn't work. What I'm saying is Sudan is now in an incredible phase in which you could refocus. So the old ways don't work because the systems were inadequate to meet health needs. Your public health people in Sudan did some fantastic work of mapping national and proposing national health strategy. You have a national health plan. It was brilliant, but now you have fewer resources with which to do it, and you're all locked down. So it's not health problems. What Sudan faces is not a health care problem, but the problem of a multi-sector focus to bring the whole of Sudan's education and Sudan's ministries to work together to refocus on improving your health. So there is, could we see the next slide, please, Professor? There's a real risk of, thank you, there's a real risk of paralysis and setbacks. You've got major damage to all these things. Your hospitals are now overwhelmed by COVID-19. All the plans that you had to do immunization, they are damaged. And it looks like you should expect a very large increase in the deaths from malaria and the other communicable diseases and the others that you were already trying to deal with. There's also going to be rises in malnutrition and the consequences of people being unable to work. All these things, they are not going to be addressed and changed by a change in the health professions, higher education. Could we have the next slide, please? What we need is a very ambitious higher education strategy led by ministers who will make changes happen. Yes, it's really important to turn out new medical and health graduates, but they're all focused on treatment. And what's needed is a new health system for Sudan, which is a preventive, primary care focused, and family medicine focused health strategy, and a health education system, higher education system, to absolutely support that. because, as the old saying goes, the doctors are fishing people out of the river, and they are treating them, resuscitating them. But sometimes they have to say, who is throwing these people in the water upstream? So unless they are educated in primary health care and deployed to provide family medicine and an entirely, well, not entirely, a new cadre of primary care professionals all across Sudan, not focused in cities, focused in community health centres, then this will not happen. And you won't do it by making a few changes in universities to curriculum. What you need is, you need to harness the energy of your young people and to educate them and make them health literate so that they understand, but also so that they can become the advocates for change. You need your faith and community leaders, all those people throughout Sudan who can change and influence public opinion. You need them to be leading this and saying this absolutely must happen and we will support it. Could I have the next slide, please? Yes, it's hugely ambitious. What you need is health minister, higher education minister, ministers for all the sectors who will say, okay, this is not easy. We will have to fight off many challenges, but we will do this. Because unless this happens, Sudan will still face all the old challenges, and the old ways of working will not meet them. So what I'm proposing is that just as in my country, we have many, many very affluent people who are sitting and blogging and saying, oh, isn't life terrible? It's so hard for me at the moment. But they're not saying life is so hard for the population. They are not saying, so I'm going to give a big piece of my money to do this. There is this huge opportunity for people who have wealth, even if it's just a few of them, to say, you know what, I'm going to sponsor a university to change. I'm going to invest even just 10% of my money in higher education. I'm going to sponsor a whole load of family medicine doctors to do this. Now, these are quite radical. Could we have the next slide, please? What we need is, Sudan needs health protection. It needs an entire, not just a cadre of health protection specialists, doctors and health professionals. It needs a whole load of people throughout the states in Sudan to understand health protection and to be able to make it happen. Because health protection is not about treating people when they're ill. It's about saying sanitation. The health sector can't do that. That has to be up to a different sector. You need action on the wider health determinants. Education is the biggest one. Housing, transport, and the environment, of course, which damages people's health and continues to do it. You also need to have people who can influence your country's food and to say, Sudan has centuries of good traditional food, which keeps our people healthy. The last thing we need is large countries trying to sell us new lifestyles and unhealthy foods to replace our traditional diet. So this is why, another reason why I say you need health advocates all through your state, all to influence families, people, communities, etc. You need health improvement, and you need to redistribute your health resources across Sudan. So instead of training some of your universities and medical schools, training people to go and work in the specialties in the big cities, what you actually need is them to turn out lots of health professionals who will actually work in the places close to people's homes, in community clinics, in people's homes, where they can advise those families on what to do about their health. Next slide, please. Can we go to the next slide? You need a national mobilization of people. You're not going to address malaria via health professionals. You're only going to treat malaria. So you need to radicalize your higher education to empower so many people in Sudan to understand about what is it that improves our health. And you need a load of new leaders for health and your higher education needs to equip these people. Next slide, please. Yes, I've dealt with that. I think what's going to be important, I don't know how you will do it, but Sudan needs not a small localized higher education program for health professionals. It will need in some way massive online learning for all people in how to avoid illness, how never to get sick in the first place, so that they don't have to go to hospital and spend money for transport, out of pocket expenses for all those health tests. So there is this massive challenge in the post-revolutionary phase to create online learning for young people to understand this and not leave it up to health professionals who are already in their 30s and 40s and 50s. You need young people to be leading this. Next slide, please. So what I suggest is refocusing medical and health education towards a preventive approach. You need a new climate in Sudan's health education system in which primary care and prevention are given equal status to treatment. And you really need a large training in family medicine to provide people with healthcare close to where people live. Next slide, please. My country, you can learn from my country in two ways. Please, the next slide. My country made a massive, brave medical decision in 1948. A small group of inspired leaders in the government set up the UK's greatest ever national achievement. And this was a national health service free to everybody. And it was based on primary care. Everybody could see a doctor close to their home. The doctors learned how the family's history. They knew the children. They learned the generations and how that family worked, and they worked to improve those families' health. You can learn from the mistakes of my country. For the last 10 years, my government in the United Kingdom has completely ignored public health advice of all kinds. They have not invested in preventive care. They ignored pandemic plans, but the main thing is that they have not invested in the multi-sector education which was needed to narrow the health inequalities. So now in my country, because the government has never invested for the past 10 or 15 years in higher education for all young people, it is now impossible for the poorest young people ever to get into university education. Do not copy this mistake. Learn from the mistakes of my government. Next slide, please. In the 1960s, 1958, 1959, one small country, this is Cuba. I'm not advocating you follow their political system, absolutely not. What they did was they set an example. A few people with vision said, we're not going to have a country in which the health of the few and the well-being of the few matters. We're going to make it a country for everybody. They rolled out a national system in which thousands of educators went out and taught people throughout the country how to read and write. They invested in preventive primary care. They equalized income. Everybody was poor, but they instituted a pension. They invested in free maternity care, and they set up a national primary care based preventive care. They now have one of the world's leading vaccination programs, and they've done this. I'm not advocating that Sudan does what Cuba did politically. I'm saying one small country made imaginative, radical steps, and their life expectancy actually exceeded that of the United States of America with its massive wealth. So don't believe you can't do these things. In India in 2011, I was very privileged to meet a health leader. This is Dr. Evita Fernandez, who runs a chain of hospitals. And she said, what we need in India is midwifery. We have a health and maternity system in which women are put through basically an industrial process. Their needs are not respected. Healthcare is abusive, and they are increasingly subjected to interventions not supported by evidence. What she did was to say, I want this to happen. I'm going to put my money into the development of a midwifery pilot. I was the person who designed that midwifery pilot. And since 2010, thanks to one person, Dr. Evita Fernandez, investing her own money in a higher education program to start and try midwifery, 11,000 women in India have now had choice, compassionate, kind midwifery care, and fantastic maternal health outcomes. So it took one woman, one strong leader, to say, I'm not going to rely on a government to do this. I'm going to invest my money. Next slide, please. Finally, I'm going to reiterate what I said, that it is now the only way for a country to increase health and life expectancy is really to change its education and extend higher education and education to all. At the bottom of this slide, you can see something called the Common Good Forecaster. Click on this link, find it. It's the Common Good Forecaster produced by United Way Worldwide. This, in 10 years of my public health practice, I have never seen anything so brilliant. I'm so envious of this. If you go to this website, you can see what happens in the United States. I know they've got loads of wealth, but it's the same principle in any country. If you go to this website, you will be able to project what happens when a country directs all its higher education and its education for the benefit of the whole population. It doesn't say we're only going to have a few graduates make use of university education, because what happens when you do that is the life expectancy in the country goes right down. The health inequalities widen massively. You have huge premature mortality. You have massive crime increases, poor mental health, and a massive rise in things like low birth rates. If, on the other hand, you extend higher education and education more widely to as many people as possible in the country, you will make huge improvements in your country's life expectancy. Education is the biggest thing. If you don't believe me, go to this website and try it out. It is absolutely the best illustration that I've ever seen of what happens when you make radical changes to education. Next slide, please. Is there another slide?
Yes, I'm just trying to.
Oh, sorry, you're too fascinated by that.
Yeah.
You are. Okay, now I'm going to stop in 2 minutes. During the pandemic, we have seen some of the world's billionaires get much more wealthy. What we've seen is one or two of them say, I'm not going to bemoan how hard life has become for me as a poor billionaire. I'm actually going to put some of my money into useful things. I'm going to use it for the common good. So I'm not going to sit in my mansion. I'm going to give a big chunk of my money, and I'm going to give it to people who can use it to extend education and health professions education and preventive care. I'm going to give it to buy vaccines for big chunks of the population. This is a challenge. Argentina said, oh, I don't think we'll make it voluntary. We will put a 1% tax on our wealthiest people. They won't notice it because they have so much money. We will use it to help the poorest with the pandemic. Now, the health inequalities in Sudan they're not an inevitable thing. They are a product of the choices you make in how you organize government and the decisions government makes and what the ministries do. So what I'm suggesting is that you now invite lots of your wealthiest people to say, I know that when the pandemic ends, it'd be really nice to have some really big weddings. But actually, weddings are not going to make a difference to Sudan's massive health needs. They're not going to stop children dying from respiratory diseases and from the old neglected tropical diseases. So perhaps instead of making choices about investing in the well-being of a few, I invite people to invest in higher education in Sudan and to extend health leadership education to lots of community leaders, faith leaders, and young people in Sudan who can become your health leaders of the future. So without it, nothing will change. Next slide, please. I think this is the last slide. It wouldn't take much money. It really would not take much money to do it. It is simply it will be the product of how you choose to organize what your country does with its money. You can send your money abroad. You can make decisions about what you buy, and you can make decisions about what you invest in. I'd say invest in higher education, invest in preventive primary healthcare, and in leadership, extend leadership to as many people as you can, and invest in your higher education in order to do that. Last slide, please. That's it. My opinions are purely my own. I'm quite aware that it's so easy for me to sit here and say, oh, you should do this and you should do that. But I'm doing this because I care passionately about Sudan's health needs. And I believe that to address them, higher education needs to focus on multi-sector action and a completely revised higher education and education system to transform your country. And you are in a political phase where you can do this. So many countries around the world are stuck. They've got outdated political systems. My own country, the UK, it's not going to change. Sudan, you have a massive opportunity to change, and I look forward to seeing it. And I think that's quite enough from me.
Thank you very much, Dr. Andy. It's been enlightening to listen to you and look at the perspective of medicine practices in Sudan from an educational point of view. And you started by saying you were addressing the Millennium Goal number 3, which is all about medicine. But we are actually going beyond that into actually addressing number 4 as well, which is education. And it's very fascinating how you've linked between the need for healthcare and the need for education to improve the primary level of education, as this brings back legacies of people like Dr. Awad Dakam, who back in the 60s and the 70s stated that Sudan doesn't need more doctors as much as it needs more nurses and more vocational trained individuals to help lead the healthcare initiative. And it's good to see that you understood the Sudan mentality in the fact that we are trying to eradicate classical diseases, never mind having to deal with the new elements of COVID and other things like that. You haven't established a roadmap in the fact that you only integrated education and health at the primary level together, but the fact that you started bringing these elements together in terms of the community medicine, in terms of the development of the undergraduates, in terms of the reflective practices, and then you started moving towards the case studies of looking at the good practices that happened in the UK in 1948, applying the NHS, and the failure of controlling the NHS in recent governments without alluding to any individuals. You've highlighted elements of the Cuba good practice, and you established that we need to move away from their political systems. But in Sudan, I think the change for public policy and policymakers is more imperative at the moment, in the fact that we fail to implement a democratic system and we have a monofocused leadership that carries on from independence till today, which led to a lot of failures here. You've also discussed some elements in terms of what happened in India and the case studies of individuals investing in the health system in India. And again, in Sudan, different individuals like Dr. Ibn Auf and Dr. Jabir Abul Aziz have invented in small diabetic centers and small healthcare centers, but they are not preventative. They are not preventative as you try to establish in your speech. They're more about controlling and mitigating the damage, whether it's for diabetes, whether it's for heart diseases. And this is where the shame of Sudan comes into the health center, is we are reactive to the aftermath of the incidents of diseases rather than actually preventing the disease and controlling it. So although you did not establish a roadmap, you've established the grounding and the seed, the nucleus that will propel Sudan further, in the fact that we need to integrate community medicine at the heart of education. We need to go a level below the educated doctor into the vocational level to help enlighten and enrich the people. And this falls into the two previous studies that were presented by Dr. Hanadi, who talked about good leadership and good governance applied into the system. And then Dr. Mubarak, who although mentioned it in terms of the health education, he talked about the policy and the need for the adaptation of higher education to deliver the elements that are required here. And this comes from the good common sense that you alluded to towards the end in terms of the website that Dr. Alam got sidetracked with, or in terms of the philanthropists who invest a lot of money from their wealth into these underpinning issues, and the fact that we should become an informed nation, an educated nation from the onset about how to prevent diseases rather than how to react to them, is the roadmap that we should adapt from your presentation. And thank you very much for someone who invested part of their life in Sudan, a country that in most cases is fought upon for the wealth, but nobody thought of the individuals within it. So to have a different perspective is very good. And I'm glad that someone such as your caliber and yourself is thinking about it from a different point of view, rather than some of the other companies and countries who are trying to change lifestyle without help improve the fundamental systems. And we've seen this historically in my sector, the petroleum sector, and other sector where the wealth is transported, but there was the lack of investment in the fundamental level. So thank you very much for your interesting presentation. And I think at this point, we're going to open the network to all three speakers to answer some of the general questions that we have for them. Thank you very much. Back to Dr. Farida.
Thank you. Okay, thank you very much. So that was very interesting, because as I alluded to, not only in this discussion, but previously, places like Africa cannot copy what has been done in the other countries, in America, in Europe. I think that in the Middle East, where they have a sort of very focused area, and Dr. Hend was excellent in that she could deal with high attainment, having lots of support to people in refugee camps. And from her perspective, and HR actually managing that, I do think, though, we have to think totally differently. And I thought Dr. Masaud in Libya has actually sat down and tried to rethink his country's strategy from having sort of high attainment traditional education to thinking where we should go. I love and one of the human things is, if you don't eat, my thing is, if you don't eat, you can't concentrate at school. If you don't have health, you're not going to go to school. So you need health, and you need a infrastructure, basic infrastructure. It hasn't to be huge to support that. And then you'll get better learning. And with better learning, you're able to get people to generate an income to support it. What I would say, following on Dr. Beckingham's talk, that there's a project in Senegal where they have a community university. And it's exactly what you're saying would be a very good thing. So it is people in the community who were taught and to focus on their good foods, to focus on how they could benefit from better health, and to use what they have at hand within the community to feed, to make healthy, all right? So, and then skills, and the skills initially are skills that are needed to build the community. And then from that, you have skills that go to a higher level. So I would like to ask Dr. Masaud, could I just challenge you, because I can't see any questions coming up. Okay, so there is actually a question from Dr. Hend, from someone who said, to Dr. Hend, your presentation.
From Professor Joseph Nakai from Uganda.
Okay. Okay, so your presentation that the ongoing pandemic has posed unprecedented challenges to leadership in higher education, calling for adaptive learning. Are there ways of developing resilience and adaptive leadership capacities? I will keep my question still for Dr. Masaud. So that's for you, Dr. Hend. So are there ways of developing resilience and adaptive leadership capacities? Can you put on your, can you unmute?
Can you hear me now?
Yes, we can.
You're still muted.
You're still muted again.
Okay.
Yeah, you're muted now.
Yeah.
Okay. Well, I mean, answering this question in a very brief and straightforward sentence is, developing capacity, leadership capacity among the students is one of our target or objectives in our higher education master programs and PhD. And this is done through different models, through different approaches during the normal academic year. But within the pandemic, it was quite a little bit difficult to develop this one, taking into consideration the tension that was created by this pandemic, specifically when we are talking about the overload of the teaching assignment and the mental health. But however, in the long term, yes, building and developing like national capacity, national leadership, adaptive leaders among the students and among the faculties, as a general, within Qatar, it's one part of the Qatar National Vision strategy, where human capital pillar really focus not only in developing the human capital, but also the employability skills and also the leadership skills and competencies among the second generation or the new generation in order to lead the whole society. Hopefully, I answered your question, Professor Joseph.
Okay, so we are going to go back to Professor Masaud. Can I just, there's a question here talking about the role of the school nurse in implementing school health needs to be achieved in Libya, Sudan, and African countries. So did you have a strong, I know some African countries have a really strong school nurse or nurse system, which would build into your health of children, Dr. Masaud. I was thinking, having heard Dr. Beckingham's talk and Dr. Hend's talk and your excellent talk, how could you take that into shaping a vision for Libya that delivers? Because you're right, one of the things you said is that, okay, you have loads more digitalization coming in and network coming in, but then you also have a load more people not on the street, but playing computer games. So how would you shape the vision, please? Dr. Masaud? I saw you a minute ago.
Yeah, he was there. I'm not sure where he was there.
Up until the internet connection is established with Dr. Masaud, can we go back to Dr. Hind and ask a question?
Can we just answer that question because that's from the floor. So you might know the answer, Dr. Hassan, about the school nurse in countries in Africa.
Well, I mean, I can only talk from the Sudanese perspective. And in Sudan, for such a long time, education has went in a different direction than having the public engagement of health associated with it. So school nurses don't exist at a school level in Sudan. I can't comment on Libya as it is. And the medical family medicine that was alluded to by Dr. Andy and other people is disassociated from the educational sector. Your education is your own welfare, your health is your own welfare, you pay and engage with it in your own manner. So I think that's where Dr. Andy's elements comes into the fact that we need to establish a preventative medicine point of view. So when we're talking about higher education, it should go beyond that into the different levels of education where the students should engage in that.
Okay, could I then just ask from the floor, Dr. Natai? You're from Uganda, aren't you? Can you just unmute? Hello, yes. I can't hear you.
Yes, please. Are you hearing me now?
Yes, I can. So can you talk from another country's perspective of the role of school nurses and how you would respond to Dr. Beckingham's talk today?
Yeah, I think what's happening, especially in our country here, I am not very sure what's happening elsewhere, but the school nurses are certainly doing their job given the pandemic. And I know that the kinds of students that they are handling now are quite many. And of course, given the infrastructure kind of challenges that we have, they may not be able to do their best, but they are trying their level best. I think that's the only thing I can say.
Okay, could I just ask you another question? In your country, how are the medical school focusing on preventive medicine?
Of course, in terms of training, they are doing a great job. But in terms of research, because of limited resources, again, the kind of research they're bringing to preventive medicine is quite limited. But in terms of training, the training is going on, but lacking that element of research. And
yes. In the medical schools, do they then take that learning out into the community?
Yeah, they do. Actually, I'll tell you that my son is a medical doctor, and one of the things that is done in the various universities now is that these students who are studying are attached to a number of communities and hospitals in the communities. So somehow they are able to practice and also get hands-on in terms of what is happening. But again, as I said, the challenge is in terms of limited facilities, but they are there in the communities.
Okay, thank you so much. And I know in Ethiopia at Jimma University, they've now got a community university where all the students learn, but have to teach out into the community. And there's a huge amount of feedback in the community into the university as well. So I'm sorry, Dr. Hassan, you wanted to ask a question?
Yeah, well, before I go into Dr. Hanadi's question about Qatar's vision and strategies, I just want to come back to the way in Sudan specifically, it's applied, it's very hard to engage with the public medicine. I'm sure Dr. Andy knows this from experiences. It's the fact that people are more engaged about the day-to-day living and having to provide for themselves. The fact that the fundamental eradicated diseases around the world still exist and manifest itself in Sudan makes it a bit harder. The fact that there is simple infrastructures in terms of food, energy, and water supply is not available. To expect then the basic need for human for education to be applied is quite hard as well. Can I go to Dr. Hend, because I just wanted to know how she alluded to the Qatar having a vision in terms of the capacity development and how we are going to go beyond that. And I wanted to know from her vision as a leader in an academic institute, how do they plan to operate this in an operational manner, the application of the capacity development, because that's what will apply everywhere else, in the fact that we need to educate people in different walks of life, not only in the health sector, in the energy sector, in the educational sector, in the communication sector, and to learn from the Qatari applications will be quite good.
Yes. Okay, Hend, can I just open you? Would you like to?
Yeah, thank you very much. Leadership believed strongly back in 1997 by His Highness the Emir Sheikh Hamad that within education only we can promote sustainable human and economic development. Without well-educated population, this is not going to be impossible. That's why we started the education reform in the mid-90s. And since then, we started getting the fruit of such investment. I'm not talking here only about females, but also about quality education. I'm talking about the higher education, where we used to have right now, like we can call it, it's a kind of richness in terms of the kind of knowledge-based specialization we are looking for. And in terms of the kind of skills and competencies that most of the graduates are having now. And needless to mention that we have more than 7 or 10 international campus, American campus, which are specialized in a specific, more demanded fields of the academia and the labor market, whether for Qatar or the region or even internationally. So education is number one. But then we have also in between like different strategies that focus, like, for example, empowering women. By empowering women, we have, getting them in the decision making and the policy making, and which is also include, by the end of the day, a lot of leadership capacity. We have also empowering youth through entrepreneurship, through different strategies and aspects, which also focus a lot on developing their leadership capacities and skills. And we have also a kind of cultural activities, political activities, economic, it really differs between organization to another one, but it comes by the end of the day under the umbrella of Qatar Vision and its strategic development plans, where many people will be developed in terms of their leadership in order to to achieve a specific purpose within specific domains, KPIs, measures, and so on. And this started not only, it doesn't cover only the youth and the women, but also includes some children in the schools, some students at the pre-university education, and so on. So this is when it comes to how is Qatar looking at it from the Qatar vision and the strategy.
Thank you. That was excellent. I think we're now at the end of our session. May I just say thank you, Dr. Hassan, Hend, Joseph, Andy, and Alan most of all, and behind all of us, could I thank Mervyn for running an excellent session. Thank you, everyone.
Thank you very much, Professor Farida and Mohammed and all of them. I think we need to give you also a big round of applause because you finished before time as well.
So please remember, if we all help and do a little bit, it will make a big difference.